At this stage, I would like to give you a brief information about the use of the frequency of the use of diagnostic tests comparatively. Previously, in the past, we were mainly for the diagnostic purposes, we were mainly using bedside observations and less technological tests, and you can easily guess or foresee the today's medical practice. There are more technology and less touch, less bedside observation or physician examination findings. That's one reason why we should know more about, study more in detail the diagnostic tests, and also be informed about how to appraise this kind of studies. As an example, I have here an anemia. How do you diagnose anemia? If you think for a while how you diagnose anemia, you would probably be able to say it is diagnosed by physical findings like pallor or facial pallor, nail bed pallor, etc. So different kind of pallors at any site. And each of these clues have some predictive value for diagnosis. And this is judged by using the terms sensitivity and specificity. Sensitivity is being able to recognize those who are sick, and specificity is to be able to differentiate those who are really healthy. As you see, palmar crease has a high specificity. That means in healthy people, we will rarely or never, almost never observe palmar creased pallor. However, its sensitivity decreases. So these are, when sensitivity is high, you have mostly lower specificity. The sensitivity in this case is only 8%. We would like to have, of course, tests which have high sensitivity as well as specificity. And this is judged by looking at the likelihood ratios. Likelihood ratio is a combination of sensitivity and specificity. The formula is sensitivity divided by 1 minus specificity. And as you see, positive, of course, for the diagnosis, we look for the positive likelihood ratio, and the positive likelihood ratio of palmar crease is high because of the very high specificity, but actually in practice, we would like to have also a high sensitivity. So since we want to rule in patients instead of ruling out, we want to diagnose, and our main purpose is to diagnose an anemia condition. There we would like to prefer probably tests with higher sensitivities like nail bed pallor. As you see, it has relatively higher, comparatively higher sensitivity. Okay, that was to give you an idea why diagnostic tests are important and what is the relationship to our clinical practice.